Alan Murray. I'm a doctor at Bay of Islands Hospital and I'm the clinical leader here for the last 3 years. Bay of Islands Hospital is in Kawakawa, which is about an hour north of Whangarei. Yeah, I've been the clinical leader at Bay of Islands Hospital for the last 3 years, and in that time, as a group of doctors, we've tried to raise the bar, aiming for excellence in rural health and trying to create Bay of Islands Hospital as a centre for excellence in rural health. Well, we all try and care for patients here as if they're our own whānau or family, and imagine that that patient is your partner or your sister or your granny, and treat them with that respect. You know, communication at Bay of Islands is on hospital. We encourage on 2 levels, both amongst the staff, being open and direct with each other, so that, you know, any problems are tried to be sorted out simply, and there aren't difficulties with communication. And with patients, just trying to understand, you know, what they're thinking. Try and put yourselves in their position and try and find out, you know, what they're worried about. You know, often people are thinking, you know, why me, why now? All those different questions, and communicating open and directly with them. There is a large Maori population in Northland, and there is a Maori health worker at Bay of Islands Hospital who can help with communication. Sometimes there are language barriers, but sometimes it's just thinking about health in a different way. You know, if you've grown up in a Western model, you tend to think very much of the medical diagnosis. But Maori people tend to think much more of their whole self, so looking after the spiritual side, the family side, and trying to deal with all that. Yeah, for me, patient-centered care is putting the patient in the middle of everything that we're doing. So everything we try and that we talk about amongst the doctors or nurses or as a team is to try and think how that will affect the patient. And then when we're dealing with patients, it's trying to put them at the middle of everything so that they're part of the decision-making process. They understand what's happening, so that we communicate directly with them, so that we try and, you know, have empathy for how they are and what they're thinking and how they feel. In reducing harm, one of the, you know, simplest and most effective things has been the hand washing amongst the doctors here in the last 3 years. There's been a real shift. A couple of new doctors came who were very enthusiastic hand washers, and some of us that had been here a bit longer were a bit lazy, and they've encouraged us just to, you know, do that on a daily basis, wash our hands in between patients. And we now have soap dispensers throughout the hospital, and signs reminding you, and signs on the computer reminding you in between patients. And I think they've all been very effective in making us do it, which is one of the simplest ways we can, you know, reduce harm that we do to patients by spreading hospital infections.